Amifostine Crystalline 500 mg intravenous solution is used to reduce the risk of kidney problems caused by a specific anti-cancer drug called cisplatin. It is also used to help prevent dry mouth, a common side effect of radiation treatment for head and neck cancer. This medication works by preventing certain chemicals from damaging healthy cells, and it may also help repair cells damaged by cisplatin or radiation treatment. The recommended daily dosage and optimal timing for taking this medication will depend on your specific medical condition and should be determined by your healthcare provider. When using Amifostine Crystalline 500 mg intravenous solution, it will be administered through an injection into a vein by a healthcare professional, typically 15 to 30 minutes before cancer treatment. The dosage will be determined based on your medical condition, body size, and how you respond to the treatment. To minimize the risk of side effects, it is important to stay hydrated while using this medication, unless told otherwise by your doctor. Your doctor may also advise you to lie down while receiving the medication to lower the chances of experiencing low blood pressure. Additionally, if you are currently taking blood pressure medication, your doctor may instruct you to stop taking it for 1 day before receiving this drug. Make sure to consult with your doctor about when to resume taking your blood pressure medication. Some common side effects of Amifostine Crystalline 500 mg intravenous solution include flushing, chills, blurred vision, dizziness, and pain/redness/swelling at the injection site. Nausea and vomiting can also occur, and your doctor may prescribe medication to help with these symptoms. Eating small meals, avoiding food before treatment, or limiting activity may also help lessen these effects. If any side effects persist or worsen, it's important to notify your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks. While many people using this medication do not experience serious side effects, it's important to contact your doctor immediately if you experience fainting, irregular heartbeat, muscle spasms, changes in mood, or seizures. Although rare, a serious allergic reaction to this drug is possible. Seek medical help if you experience symptoms such as fever, rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. In the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before starting Amifostine, make sure to inform your doctor or pharmacist of any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions or other issues. It's important to discuss this with your pharmacist. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have low or high blood pressure, dehydration, heart disease, kidney disease, or if you have had a previous stroke. Amifostine may cause dizziness, drowsiness, or blurred vision. It is important to avoid alcohol or marijuana, as they can increase these effects. It is advised not to drive, use machinery, or do anything that requires alertness or clear vision until you can do so safely. Limiting alcoholic beverages is also recommended. If you are using marijuana, it is important to talk to your doctor. If you are planning to have surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or planning to become pregnant, it's important to let your doctor know. Because amifostine is used with anti-cancer treatments, which may harm an unborn baby, it's important to use reliable forms of birth control while using this medication with anti-cancer treatments. If you become pregnant, it's important to speak with your doctor right away about the risks and benefits of amifostine and the anti-cancer treatments. It is unknown whether this medication passes into breast milk, so it is not recommended to breastfeed while using this drug. Consulting with your doctor before breastfeeding is important. It's important to talk to your doctor or pharmacist about any other medications or products you are using, as they may interact with Amifostine Crystalline 500 mg intravenous solution and affect how it works or increase the risk of serious side effects. This includes prescription and non-prescription drugs, as well as herbal products. Make sure to keep a list of all the products you use and share it with your healthcare providers. Also, let them know if you are taking any other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. Be sure to check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. If you have any concerns or questions about using these products safely, don't hesitate to ask your pharmacist. If someone has taken too much of Amifostine Crystalline 500 mg intravenous solution and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical assistance by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can reach out to a provincial poison control center for help. It is important to have lab and medical tests done while using Amifostine Crystalline 500 mg intravenous solution, such as blood pressure and serum calcium levels. Make sure to keep all medical and lab appointments and consult your doctor for more details. Make sure to take your scheduled dose of Amifostine Crystalline 500 mg intravenous solution as directed by your doctor. If you happen to miss a dose, be sure to consult with your doctor or pharmacist to get a new dosing schedule. It is important to stick to the recommended dosing schedule to ensure the medication's effectiveness. This medication is typically given in a hospital or clinic setting, and it is not meant to be stored at home. Amifostine Crystalline 500 mg intravenous solution is used to help prevent or lessen some of the side effects caused by certain chemotherapy drugs. It is administered intravenously and the dosage and timing will be determined by your healthcare provider based on your specific treatment plan. It is important to follow their instructions carefully. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.